Good afternoon, this is Dr. Mohan from RM Pain Relief Solutions. Today I'll be talking about the role of platelet-rich plasma therapy in the management of knee osteoarthritis. Knee osteoarthritis is a degenerative process. As we age, so do the knee joints. There is lack of lubrication of the knee joints, there is loss of cartilage volume, and in severe cases, the bones touch each other, and this causes a lot of pain, swelling, and stiffness. In more advanced stages, along with pain, swelling, and stiffness, there is also deformity, and this leads to significant disability for the patient. Management of knee osteoarthritis can be divided into conservative strategies, minimally invasive techniques, alternative therapies, and surgery. Conservative strategies include the use of ice therapy, alternative ice and heat therapy, weight reduction, massages, physiotherapy, and knee strengthening exercises. Interventional minimally invasive techniques include intra-articular injections of corticosteroids, hyaluronidase, which is a joint lubricant, and platelet-rich plasma therapy. Alternative therapies can be tried and must be tried, and these include Ayurveda, massages, yoga. And if all else fails, surgery is the gold standard. Many questions asked regarding platelet-rich plasma therapy. What exactly it is? Is it very useful? Is it like a magic bullet, and does it work for all cases? What are the indications and what are the uses of platelet-rich plasma therapy? Basically, platelets are important constituents of the blood. Blood has three important cells, and these include red cells, which are helpful in oxygenation, white cells, which are useful for warding of infections, and platelets, which play a very critical role in the healing process as well as clotting. Do platelets have regenerative capacity? The answer is no. I'd like to call it as joint preservative strategy. Platelets do not cause any regeneration of the lost cartilage. It helps preserve the joint in the stage that the patient is. Probably it might improve a bit of joint function and also pain and inflammation. Does PRP help in all cases of knee osteoarthritis? The simple answer is no. It usually helps in grade 1, 2, and possibly 3 of osteoarthritis, certainly not in grade 4 osteoarthritis. It is not a magic bullet, and it does not work on its own. It has to be combined with other strategies, and that includes knee strengthening exercises, maintaining a healthy physical life, and also weight reduction. How do platelets affect or act in osteoarthritis? Platelets basically contain many growth factors which help in the healing process. It also has got anti-inflammatory properties, and it is known to increase the volume of the cartilage inside the joint into which it is injected. It also improves lubrication and also the quality of lubrication. So the viscosity or the thickness of the lubrication inside the joint increases, and ultimately this leads to a reduction in pain, swelling. What is the procedure to obtain platelet-rich plasma therapy? About 40 to 50 ml of patient blood is transferred into special test tubes, and this is basically put in a special device which spins the collected blood at a certain rate for a certain time, and during this process the red and white cells are separated and concentrated platelets are obtained. During this process, the platelets are concentrated to up to 1 billion per ml. The processed concentrated platelets are then injected into the affected knee under combined ultrasound and X-ray guidance and under strict aseptic precautions. Is one injection of platelet-rich plasma therapy enough? The answer is no. Ideally, you need 3 separate injections of PRPs, and this can be done on a weekly basis or a monthly basis. The whole purpose of the treatment is to reduce inflammation inside the joint and also help in the healing process. Is the procedure of injection very painful? The answer is no. We keep the patients comfortable by using local anesthesia, and if the patient is very anxious, we might pop in a little drip in the hand and help with sedation and anxiolytic medication. Usually there is not much pain immediately after the procedure, but for the first couple of days, joint feels sore, and in some cases it can actually increase the pain. A patient should not be too worried about this, and it is very important that the patient do not take any painkillers during this process. The reason being, any painkillers will affect platelet function and also the efficacy of the treatment. The patients are allowed to walk after the procedure with minimal weight bearing for a couple of days, and after 2 days patients are able to do auditory activities, and after a week they usually resume knee strengthening exercises, and this process is continued over the 3-month period of the injection. Every time the patient has an injection, a couple of days of less weight bearing on the knees, followed by routine activity for up to a week, and then knee strengthening exercises, which should be done up to 3 times a day.